Good day, everyone. My name is Sherilyn Del Hero from BSN1B, and for today's video, I will demonstrate to you on how to perform a bed making. Definition: the closed bed. This bed is made up of their service personnel. Have cleaned and unit following a patient discharge. Purpose: the bed is made of cloth, so it will stay clean until a new patient is assigned to it. So the materials and equipment, the first one is a bottom sheet. Number two is a plastic drew sheet or disposable bed protector. Number three is a cotton drew. Number four is top sheet. Number five is a blanket. Number six is a bedspread. Number six is a pillowcase or pillow protector or if it's used in the institution. Procedure: assessment. Determine the need of the bed lining change. Planning: wash hands. Gather lining to be used and arrange according to the use sequence. Assemble the equipment, mattress covered if used in a healthcare institution. Bottom sheet, cotton and plastic drew sheet or disposable bed protector. Top sheet, blanket, bedspread, pillowcase, pillow protector if used in healthcare institution. Implementation: place a chair near in the bed. Put the pillow on the chair, stack the bed-making lining items on the chair, and in order that you will use them. First things to be used on the top, last things is used on the bottom. 8. Adjust the bed to the highest horizontal comfortable floor position. Lock the bed in place. Pull the mattress to the head of the bed until it touches the headboard. Place the mattress pad on the mattress even when the head edge of the mattress is used by your healthcare institution. Fold the bottom sheet lengthwise and place it on the bed. Open the sheet. It should now hang evenly, the same distance over each side of the bed. The rough edges of the hem should now face down toward the mattress and away from the patient. There should be 18 inches of the sheet to tuck smoothly and tightly under the head of the mattress. To make metered corner, pick up the edge of the sheet at the side of 12 inches from the head of the mattress. Stand and work entirely on one side of the bed until the side is finished. Fold in half and place in the plastic drew sheet 14 inches. Two open hand spans down on the bed. Tuck it in. Be sure each piece of lining is straight and even as you tuck it in. Cover the plastic drew sheet with the cotton drew sheet and tuck it in. Fold the top sheet lengthwise and place it on the bed. Fold the blanket lengthwise and place it on the bed. Fold the bedspread lengthwise and place it on the bed. Now get the other side of the bed. Start with the bottom sheet. To make cuff, fold the top hem of the spread under the top hem of the blanket. To put the pillowcase on the pillow, hold the pillowcase at the center of the seam. Adjust the bed to its lowest horizontal positions. Wash hands. Evaluation. Evaluate correctness of the procedure rendered. 27. Evaluate others' needs of the patient. Documentation. Document any unusual circumstances observed such as blood, stain, discharge on the sheet. Open bed. Definition: when a patient is assigned to a unit, the closed bed is made into an open bed by folding top sheets down to the foot of the bed. Purpose: the bed is made when a new patient is already assigned. The procedure of the open bed. Assessment: assess for any malfunction equipment. Planning: assemble equipment and wash hands. Implementation: grasp of the cough and the bleeding in both hands. Fan fold to the foot of the bed. Fold the bedding back on itself toward the head of the bed. The edge of the cuff must meet the fold. Smooth the hanging sheets on each side neatly in the folds you have made. Wash your hands. Elevation: correctness of the procedure. Evaluate other needs of the patient. Document any unusual circumstances observed such as blood stain, discharge on the sheet. Occupied bed. Definition: the occupied bed is made with the patient in the bed. Purpose: to ensure the patient remains to be in the bed when the patient is with a CBR or complete bed rest order or patient is completely bedridden. Procedure: assess client's activity order, check linens needed. Planning: wash hands, gather linen and arrange according to use. Assemble your equipment. Implementation: identify the patient by checking the identification bracelet. Ask all visitors to step out of the room if this is your hospital's policy. Tell the patient you are going to make in the bed. Pull curtain around the bed for privacy. Place a chair near the bed. Place the clean linens on the chair in the order which you will use them. That is, the last item to be put on the bed should be on the bottom of the stack. Lower the backrest and the nearest until the bed is flat. If that is allowed, raise the bed to a comfortable working height and lock in place. Loosen all the sheets around the entire bed, taking the bedspread and the blanket off, and fold them over back on the chair, leaving the patient covered only with the top sheet. Cover the patient with a bath blanket by placing it over the top sheet. If the mattress is slipped out of the place, move it to its proper position, touching the headboard. Ask another nursing assistant to help if necessary. Raise the bedside rail on the opposite side from where you will be working and lock in place. Ask the patient to turn onto his side toward the side rail. Help the patient to turn, if necessary. The patient is now on the far side of the bed. Adjust the pillow for the patient according to instructions. If the patient cannot stay to lock arms with him, raise him to remove the pillow. Fold the cotton dress sheet toward the patient and tuck in against the back. Raise the plastic dress sheet if it is clean over the bath blanket and the patient. Fold the bottom sheet toward the patient and tuck in against his back, and strip their side on the bed down to the mattress. Take the large clean sheet and fold it in half lengthwise. Do not permit the sheet to touch the floor on your uniform. Place it on the bed, still folded, with the fold running along the middle of the mattress. Meter the corner at the head of the mattress. Tuck in the clean bottom sheet on your side from the head to foot and the mattress. Pull the plastic drawer sheet toward you over the clean bottom sheet and tuck in. Place the clean bottom drawer sheet, which is the folded half, over the plastic sheet. Raise the bedside rail on your side of the bed and lock it in place. Go to the opposite side of the bed. Lower the bedside rail, ask the patient or help him to roll over the hem onto the clean sheets away from you. Be careful not to let the patient become wrapped up in the bath blanket while turning. Remove the old bottom sheet and cotton drawer sheet from the bed. Pull the plastic drawer sheet and clean cotton drawer sheet toward you. Then, one at a time, tuck the drawer sheets under the matters along the side. Be sure to securely pull all sheets as you tuck them in for a tight foundation. Have a patient roll in back or turn him yourself, loosening the bath blanket as he turns. Change the pillowcase and place the pillow under patient's head. If necessary, lock arms with the patient and raise him to place pillow under his head. Spread the clean top sheet over the bath blanket with the wide hem at the top. Tuck the clean top sheet under the mattress at the foot of the bed. Make sure you leave enough room for the patient to move his feet freely. Spread the blanket over the top sheet. Tuck in the blanket in the foot of the bed. Make a metered corner. Place the spread on the bed in the same way. Make metered corner with the spread. Go to the other side of the bed. Turn the top covers back and meter to the top sheet. Then meter the blanket. Then meter the spread. Be sure the top covers are loose enough for the patient to move his feet. To make the cuff, fold the top hem edge of the spread over under the top hem of the blanket. Cuff wrap edge of the hem and sheet must be turned down so the patient does not come in contact with it. Raise the backrest to suit the patient if this allowed. Make the patient comfortable. Lower the bed to a position. Safety for the patient. Fold the curtains back position. Raise the slide rails order indicated and appropriate patient safely. Place the call light within easy reach of the patient. Put used linen in the plastic laundry bag and place the lamp where wash your hands. Evaluation. Evaluate the correctness of the procedure done. Evaluate the patient tolerated of the procedure. Check any Unusual observations. Document. Record you have made occupied bed and how the patient tolerated the procedure. Your observably your observation of anything unusual. Post-operated bed. Operating room bed, anesthetic bed, recovery bed, or stretcher bed. Definition. The post-operative bed is also known as operating room bed, anesthetic bed, recovery bed, or stretcher. The post-operative bed is bed made from patients returning from the recovery room. Purpose: to allow easy transfer of the patient from the stretcher to the bed. With bath blanket, this bed is made to keep patient warm.